and thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, I'm going to do another Ask Dr. Plenty session. But before we get started, please click the subscribe button below, subscribe to my channel, make sure you share with a friend. We'll be back. Okay, welcome back. So today we're going to get into questions that you have emailed me over the last month. I've already answered these questions for the people that have emailed me, but since I've received numerous of the same question, or basically the same topic, I want to make sure that I addressed it for everyone that follows their channel. So let's dive into the questions. The first is, when should I worry if I can't get pregnant? Well, that really depends on the situation, meaning how old are you? How long have you been trying to get pregnant? As a general rule of thumb, if you cannot get pregnant after 1 year of actively trying, if you're under age 35, or 6 months of actively trying, if you're over age 35, then you should seek further care. Your OBGYN will refer you to a reproductive endocrinologist or infertility expert that can talk to you about further options if you can't get pregnant during those time frames. Now, let's talk about what we mean by active. So that means that we're keeping an ovulation calendar and a calendar of our menstrual cycles, and you're having sex on those active days. Generally speaking, people that have a 28-day cycle or regular cycle will ovulate on days 8 to 11, okay? Not day 14. Usually once you get day 14, that's like the last day of that ovulatory period. But like for me, my cycle is 25 days. I ovulate on days 8 through 10. That is 8 days after the first day of your last menstrual cycle. So let's say that you ovulate 31 days. So that means that your active ovulatory days will probably be somewhere around day 10 through 13. So that means that in that time period, you should be having sex at least every other day during that week of your predicted ovulation. Now, if your husband's out of town, you're out of town, you guys aren't sexually active, then you can't say that you've been trying for a whole year when you've only been trying for a couple of months, but you've been wanting to get pregnant for a year. You have to actively try. You have to actively keep up with your cycles. If your cycles are spaced to greater than every 32nd day, then that may mean you're not really ovulating. You're having anovulatory bleeding, which will require further workup. Okay, so realistically, you should have a cycle at least every 31 days. And if you didn't, you need to seek further care. All right, our next question is, besides miscarriages, what are some reasons for vaginal bleeding in the first trimester? So, of course, a miscarriage can cause some vaginal bleeding or spotting. Usually people have pain followed by cramping with heavier vaginal bleeding, but you can have a miscarriage with or without bleeding. So let's say we rule that out. You can have implantation spotting. That usually happens about 10 to 12 days after your missed period. So you're a couple weeks along. Usually you have that even before you find out you were pregnant. Some people say, well, I had a period last month, so I didn't think I was pregnant. That may have been some implantation spotting, where that embryo, those first couple of cells of life, are implanting into the wall of the uterus, and as it gets nestled down deep in there, the endometrial lining can shed there. So implantation spotting. Some people, especially in the first trimester, can have what's called a subchorionic hemorrhage. There are two layers of the gestational sac, or the sac that contains the baby, and that's the amnion and the chorion. If you have blood that collects between those two sacs, that's a subchorionic hemorrhage, or a hemorrhage below the level of the chorion. If you have a big hemorrhage below the level of the chorion, that can cause you to be at risk for, of course, detachment of the pregnancy or separation, which can cause a miscarriage. A lot of times we see these are very common. You can have spotting, which is just annoying, and the baby is completely fine. You would need an ultrasound to make sure that the heartbeat is still there. If you have heavier bleeding, that would mean you need to be reevaluated again to make sure that the pregnancy is still intact. But a subchorionic hemorrhage, being small, usually won't cause too much harm, and over time that collection will reabsorb, and we no longer see it on ultrasound. So in the meantime, if you have that, your OBGYN may tell you to go on pelvic rest, meaning don't have sex, to ask to not irritate or cause bleeding. And then once it resolves, you can go back to your normal pelvic activity. Other causes, some people may have an actual laceration, especially if you've had rough sex. You can have a laceration on your cervix. You can have a laceration inside the vagina. Some people can have polyps that are on the cervix. Sometimes those polyps can even be on the inside of the cervix toward the baby. We would not remove that during pregnancy. We just monitor it. But that a cervical polyp can cause you to have some spotting in the pregnancy. Some people get pregnant with polyps inside the uterus, and then as the uterus grows or the baby grows, you can have some spotting as that polyp is compressed. Usually we don't have issues with that as the pregnancy goes past or beyond the first trimester, but in the meantime it can be annoying and cause you to have some spotting. And then of course if you have certain STDs, you can have some spotting if your cervix is inflamed. And in general, if you have sexual intercourse in pregnancy, which you all should, unless there's some other reason you shouldn't, you can have some spotting because the cervix is very vascular and it is engorged in pregnancy. So that is another reason that you can have spotting in the first trimester. The third question: I have fibroids. Should I have them removed before pregnancy? I have so many questions about fibroids, and I do have, there is a podcast episode about fibroids and pregnancy, as well as, I'm pretty sure I have a video specifically about that, but I think I'm going to do a video specifically about whether or not you should get them removed if you're trying to conceive. This is something that's near and dear to my heart because if you followed me, you know that I have fibroids, and I had fibroids and complications of them in pregnancy. And before I got pregnant, I would always say, if they're not bothering you, don't bother them. And I still hold firm to that belief. I don't think that people should get unnecessary surgeries. But if you're having fibroids that are huge, even if you don't have bleeding associated with them, then you may want to consider getting them removed before. Fibroids can put you at risk for having smaller babies if you get pregnant. Can also put you at risk for fibroid degeneration or the fibroid outgrowing the blood supply in pregnancy and then basically necrosing on the inside and dying. It doesn't harm the pregnancy, but it can cause you to have some pain. For me, my fibroids, because they were in the lower part, in the back side of the uterus, caused compression on my vessels that return blood to the heart, called the iliacs, and it caused me to have a major blood clot in my leg. And I would have never thought that would have happened. That is not something that's labeled as a risk factor for fibroids, but it happened to me, and I had 3 pulmonary emboli. So if I were ever to get pregnant again, I would want to make sure these fibroids are smaller, and if they're not, I would probably consider getting them removed. With that being said, if you're completely asymptomatic and your fibroids are very small, I would say leave them alone. Like, you don't have to get them removed before trying to conceive. If you've had a miscarriage and you're trying to conceive and you know you have fibroids, then I would get them removed before trying another pregnancy. Fibroids that cause you to have issues, heavy bleeding, pelvic pain, yes, get those removed if you can. If you are pregnant and you have fibroids, most of the time you're going to be fine, except for the generation, and you need the growth of the baby checked. My case was very rare, so I want to make sure that's, I don't want you to scare anyone. My case is very rare, but with big fibroids, because it can cause you to have some issues with, breathing, discomfort, I would consider getting those removed before trying to get pregnant. For your specific issue, talk to your OBGYN about that. I mean, they will look at your cervix and your uterus very thoroughly to see if you have fibroids blocking the cervix, or if you are going to have an issue with a pedunculated or fibroid on a stalk hanging over that could cause you to have issues breathing in pregnancy if it's at the top. They'll talk to you specifically about the concerns and make a plan for you before you get pregnant. My doctor encouraged me to lose weight prior to getting pregnant. Why, when I'll only gain weight anyway? So you're right. Even if you are obese, you should still gain 11 to 20 pounds during the pregnancy. I do have a video that is on nutrition and weight gain in pregnancy. My son Harrison is running around the video. Go watch that video. It goes over what you should target, like your target weight should be in pregnancy. So you have a point. You will gain weight. You need to gain weight in pregnancy. Everybody does. But if you're trying to get pregnant, it would be more advantageous for you to lose weight first to optimize your health before you get pregnant. Losing weight before pregnancy, even as little as 10 pounds, will decrease your risk of getting gestational diabetes. It will decrease your risk of preeclampsia, and it will decrease your risk of other complications in pregnancy, such as needing an operative delivery, having a small baby if you don't have gestational diabetes, as well as undiagnosed fetal anomalies. People that have obesity do have an increased risk of fetal anomalies, and it's harder for us to see those anomalies on ultrasound. So I don't know if it's really that we can't see them or that you obviously really do have an increased risk. The data is very conflicting with that. But we want to be able to diagnose you. So you do want to lose as much weight as you can to get down to your ideal body weight or at least a healthier weight. You are at increased risk for preeclampsia. Anybody that has obesity needs to take baby aspirin, 81 milligrams once a day to help reduce your risk of preeclampsia, unless you have an issue with bleeding in general, like a clotting or bleeding disorder. You talk to your OB or your primary care provider about that. If you have issues like factor V Leiden mutation, you should be on it. But if you have like hemophilias, you should not, because obviously you have issues with too much bleeding. So obesity can cause a lot of things, and so your OB or your physician or whomever told you that was telling you right to reduce your risk, live a healthier lifestyle, be more active first. That way you decrease your risk of bad stuff happening during the pregnancy. And yes, you will gain weight back during the pregnancy, but as long as you're maintaining a healthier lifestyle before, it should be easier for you to lose weight afterwards. Well, I hope this helps. Thanks for watching the video. If you haven't already done so, click the subscribe button below. Also, make sure to share this channel with anybody that wants women's health tips, trying to get pregnant, just got pregnant, or maybe a toddler mom like me. I'd love for them to share in the family and the conversation. If you or anybody you know has pregnancy complications and you want us to talk about them on the podcast, also email me at pregnancypearls@gmail.com. Make sure also to subscribe to the podcast. I am everywhere you want to be in terms of that, on Apple Podcasts, Google Podcasts, Spotify, iHeartRadio, or pretty much any platform. I do have a link tree and I'll drop it in the comments below. Thanks for watching. Bye.